Hello doctors, welcome to my channel. Have you feel hip joint so hard? Wait a minute. Let me explain. We will make it easy. Hip joint. It's type synovial joint, ball and socket joint. Next, articular surfaces. Head of the femur and acetabulum of the hip bone. Here is the head of the femur, fovea and neck, and here is the acetabulum of the hip joint. It's so simple. It is like a ball and it's like a socket. Hence it's called as the ball and socket joint. Next, head of the femur forms more than half of the sphere and it's covered with hyaline cartilage except at the fovea capitis. And then acetabulum present a horseshoe shaped lunate articular surface and an acetabular notch and acetabular fossa and lunate surface covered with the cartilage. Articular surface on the head of the femur on the acetabulum are the reciprocally curved. They are not coextensive. They are reciprocally curved. They are not coextensive. Is the star point here. And then we will talk about the stability of the hip joint. Hip joint is the unique in having the high degree of stability as well as mobility. How? The stability or strength depends on, first one is the depth of the acetabulum and narrowing its mouth by the acetabular labrum, and then the tension and strength of the ligaments, then strength of the surrounding muscles, that gluteal medius, gluteus minimus, and the ligaments are afterwards we will see that. Then the length and obliquity of the neck of the femur, and finally atmospheric pressure. Then here there are the 7 ligaments are there. We will discuss about that. The fibrous capsule, iliofemoral ligament, pubofemoral ligament, ichiofemoral ligament. Here hip bone contains 3 parts like ilium, pubis and ischium. So it's attached to femur. There are the 3 ligaments called ischiofemoral, pubofemoral and iliofemoral ligaments. And then the ligament of the head of the femur, acetabular labrum and transverse acetabular ligament. I will explain each in detail. First one is fibrous capsule. It attached to on hip bone on femur to acetabular labrum including transverse acetabular ligament and to bone above and behind the acetabulum. On the femur to intertrochanteric line in front and 1 cm medial to intertrochanteric crest behind. From front and behind its attachment, and anterior superiorly, posterior inferiorly. Capsule is thick anterior superiorly and thin in posterior inferiorly, loosely attached to bone. Hence dislocation can occur posterior inferiorly. Capsule made up of 2 fibers each. Not that much important, you can remember. Then next we will discuss about the iliofemoral ligament. It is the inverted Y-shaped, lies anteriorly and it prevents the trunk from the falling backwards in the standing posture. It is present anteriorly, so it's prevents trunk from falling backwards. Apex is attached to lower half of the anterior inferior iliac spine and base. Upper oblique and lower vertical fibers form thick and strong bands while middle fibers are thin and thick. Afterwards, while we will see the diagram, you can understand very clearly. Third one is the pubofemoral ligament. Suppose the joint inferomedially, it is a triangular in shape, superiorly attached to iliopubic eminence, obturator crest and obturator membrane. Inferiorly, it merges with anterior inferiorly part of the capsule and lower band of the iliofemoral ligament. Then fourth one is the ischiofemoral ligament. It is the comparatively weak than others and covers the joint posteriorly. Fibers of the ligament forms the zona orbicularis. Fifth one is the ligament of the head of the femur. It is the flat, also called as round ligament and ligamentum teres. Triangular in shape, apex attached to fovea capitis, base attached to transverse ligament and margins of acetabular notch. May be thin or absent sometimes and it transmits arteries and blood in the joint. Sixth one is the acetabular labrum, fibrocartilaginous rim attached to margins of the acetabulum. In triangle cross section, it narrows the mouth of the acetabulum. This helps in holding of the femur in position. Seventh is the transverse ligament of the acetabulum, part of the acetabular labrum which bridges the acetabular notch. Notch is thus converted into foramen, which transmits acetabular vessels and nerves to the joint. And here ligaments are the over, and here relations of the hip joint. Relations can easily understood by the diagram, and you can imagine and you can practice the diagram. Here you should only remember from below to up these mnemonics. For anterior 4 IF3, for posterior 6 and superior RG3, that's 4 relations, inferiorly 7, and here is the mnemonic GOLAH. Here so simple mnemonics are there. Mnemonics and diagram you should practice 2 to 3 times. One time without book you can easily write the relations of the hip joint. Next, we will see about the blood supply. Hip joint supplied by the obturator artery, two circumflex femoral arteries, and two gluteal arteries, that's superior and inferior. Medial and lateral circumflex femoral arteries form an arterial circle around the capsular attachment on the neck of the femur. Then retinacular arteries arise from the circle and supplies intracapsular part of the neck. Then the greater part of the head of the femur. Small part of the head near the fovea capitis is supplied by the acetabular branches of the obturator and medial circumflex femoral arteries. Next one is the nerve supply of the hip joint. Femoral nerve, anterior division of obturator nerve, nerve to quadratus femoris and superior gluteal nerve. Movements of the hip joint you can do while studying like flexion, extension, abduction, adduction in anterior-posterior axis, medial and lateral rotation around vertical axis, circumduction is a combination of foregoing movements. Circular movement of the leg. Hip joint extension with the slight abduction and medial rotation is the close packed position of the joint. Once do that, all the ligaments and capsules are most taut in this position. It is dangerous, may be dangerous, and the flexion is limited by the contact of the thigh with the anterior abdominal wall. Similarly, Adduction is limited by contact with the opposite limb. Range of the other movements is different from one another. Extension can be 15 degrees, abduction 50 degrees, medial rotation 25 degrees, and lateral rotation 60 degrees. These degrees you should not mention in exam, not that much important. Here important is movements and its chief muscles: flexion psoas major iliacus, then extension gluteus maximus and hamstrings, adductor brevis and longus magnus, and abduction gluteus medius and gluteus minimus, medial rotation tensor fasciae latae, and lateral rotation two obturator, two gemini, and quadratus femoris. Here is the diagram showing the fibrous capsule, ligamentum teres femoris. Ligamentum teres femoris is the ligament, and synovial membrane, acetabulum, it is the fibrous capsule, synovial membrane, and zona orbicularis, it is the head of the femur. Next diagram, we will see the ligaments of the head, hip joint, and then once see the diagram, here's the fat, and then the ligaments of the hip joint: iliofemoral ligament, Y shape, pubofemoral ligament, and here is the greater trochanter. Let's see another ligaments: iliofemoral ligament and ischiofemoral ligament. Because of the it is strong ligament and supports the hip joint. In this diagram, you should practice these muscles and some nerves and arteries. You should draw this by your own 1 to 2 times. Practice it for 3 to 4 times. You can easily remember the relations. And in next video we will see the knee joint. If you like it, share,